Living with bipolar disorder has led Bill Pringle to dark places. He's attempted suicide 8 times. Once, police handcuffed him.
Essentially, they accused me of attention seeking and would not call an ambulance for me.
Other times, he got the help he needed. But recent police responses to mental distress calls have not always worked out that way, like the case of this BC woman dragged across the floor, and this incident near Toronto, which ended with a man dead.
Just about everywhere the police are coming into question, and mental health cases are amongst the most difficult to deal with at the best of times.
This mental health crisis team in Hamilton is often the first on the scene for those difficult cases. A therapist paired with a specially trained officer. Since starting 5 years ago, mental health apprehensions have dropped.
We can't expect officers to do a full psychiatric assessment, and that's really what part of my job is to do that assessment.
Integrated mental health units are not new. Most Canadian cities now have them, but they're not all available around the clock, and sometimes they're brought in too late, and it's often police who are still in charge. That's prompted calls for change.
I've taken knives away from people in the emergency room.
This veteran mental health nurse used to work in a team with Toronto Police. She says mental health workers can and should take on more responsibility during calls.
I just think it's a whole different tone when the police enter, and it can really frighten people. And I think if they're great to have them as backup, absolutely, but a more prominent role for the mental health expert.
That's what Sweden has done with its mental health ambulance, staffed by nurses and paramedics, a response to a suicide rate higher than Canada's. Half the time, police aren't even involved. This legal scholar has long called for a redesign of mental health crisis care, one that gives patients a voice.
They should be the designers of a comprehensive range of services and supports, and involve others, mental health professionals, legal professionals, and police service providers at the end rather than at the beginning.
It's a tall order that demands the commitment of more than just police. Vic Adopia, CBC News, Toronto.